So Dr. Terry Miller is at Creighton University. She does the law education for the pharmacist students there. And so Terry is I got in touch with her kind of like how I did with Keisha, our last presentation. We were attending the same meeting virtually. And I emailed her off to the side. I think it was a state meeting. And I said, hey, Terry, would you be interested in presenting? And right away she said, yes, actually, I think it was for fall seminar. And she wasn't available. And then she said, yes, she definitely wants to do this one. So have they clapped and welcomed you yet?
No, but that's
Please,
okay.
help me in welcoming Terry.
Wait till the end. Wait till the end. Although I guess I should say maybe I won't get a clap at the end, so maybe it's good you clap now. It's all good. So yes, as Judy said, we actually serve on the legislative committee together for Nebraska, and after one of the meetings where I just couldn't keep my mouth shut, she asked me if I would consider coming and talking, and yes, I couldn't at that time, but I'm glad I got a second opportunity to come. First of all, I'm not your girl that if you want to know what exact place in the statute this is found, okay, I'm just going to tell you. I have to go look it up. I have a pretty good idea what it says, but I'm going to have to go look it up. So if you want to burn me on that, you will, if you want to ask me about that. But I have, I'll give you some of my credentials later in the presentation because of what I'm doing. But for now, just suffice to say that I do teach pharmacy practice law. And my classroom is a combination, represents 30 states and 1 territory last year, and this year it was 32 states and 1 territory. So I'm just going to tell you now, it's kind of like this room, because how many of you are not from Nebraska? Okay, so I have a reasonable amount. I mean, I saw over 10 hands, and so some of the laws, and that's why I'm not going to spend a ton of time on Nebraska law, because some of you are like, I didn't come here for that. You know, I don't have to abide by that. But what I do want you to understand is why it's like that. Okay, so that's really what we're going to do. And when we have like a question, do they have to answer all the questions right to get the credit for this or not? Because I'm going to help you out on that and be pretty upfront. I'm not here to trick you, okay? So first of all, I have no conflict of interest, real or apparent, no financial interest in any company, product, or service mentioned in the program, including grants, employment, gifts, stock holdings, and honoraria. I'm here because I want to be today. All right, so we're going to talk about state and federal laws in summary and their differences while applying them to real life scenarios. We're going to discuss the best approach to becoming licensed in a new state, because that's a real thing. You know, I mean, it makes you more marketable, right? If you want any mobility, then it's not surprising to know that you would want to get licensed in another state. And if you're in a border area, that very well could be the case. I know that some of the companies, even locally, they look for that or require that before they hire you. Depends on the competitiveness of the market. So we'll talk about that just briefly. And then we're going to talk about expanding our communication within the workplace to facilitate positive peer relationships and effective conflict management resolution. I've spent most of my life, and I've had almost a 30-year career in pharmacy practice, not academia. I'm a transplant into academia. I am not your normal academic, okay? And so this probably will be a little bit different perspective than what you might hear from somebody who's in academia. All right, the first thing I want to just explain over the top is federally, this is going to be a quick review of government. At the national level, we have 2 bodies in the legislative branch. Does anybody know what's the job of the legislative branch? I'm an interactive girl, so I might just ask you questions. Anybody know, what does the legislative branch do? They make law. Okay, very good. So they make law. It's Congress is composed of 2 bodies. It's the Senate and it's the House of Representatives. Anybody know what the Senate, why are there 100 senators and 435 people in the House of Representatives? 2 senators per state. House of Representatives is based on population. So what states are going to have the most members? California, Texas, people with the most population, the states with the most population, they're going to have more representatives. But that's why they balance it with another body, which is the Senate, which just has 2 per state. So ultimately, bills have to pass each one of those bodies and then be signed by the president to become law. Or they could be vetoed, and then they can override the veto. But that's generally the process of how a law is made from the legislature. And those have a specific name. They're called statutes. So when you see something called a statute, you can just know that that came from the legislative arm of the government, whether that it was federal or most states, not Nebraska, but most states have this model where they have two bodies in their governing, in their lawmaking body. So they'll have a state Senate, they'll have a state House of Representatives, and they have the same type of process. All right. So in the federal statutes, they're contained in the U.S. Code. So if you ever see like Title 21 USC drug, that's because it was made in the legislative branch, recorded and documented in a publication called the U.S. Code. All right, so the executive branch. What does the executive branch do? Enforce the laws. This is somebody who paid attention in government class over here.
I'm just a bill on Capitol Hill.
So in the executive branch, we have the president and then the cabinet and the vice president and the cabinet. And so you can see a partial list there. Department of Health and Human Services, that's a federal body in the executive branch. They also have Health and Human Services at the state level, okay? So that would be part of the executive part of government. And that's the Food and Drug Administration. The FDA is contained under that. Public Health Service, Centers for Disease Control, the NIH, Indian Health Service, Department of Justice, another cabinet. They have the DEA under them. So these are executive branch bodies, okay? You notice that there's some non-cabinet agencies. Consumer Product Safety Commission, they oversee the Poison Prevention Packaging Act. Okay, that makes sense, right? If they're a safety commission, they're gonna take care of things like that. Federal Trade Commission, they're involved in some of the advertising. All right, they can also, by executive order, make rules, and we call those regulations. So they have usually a comment period where they're going to propose the rule, and then they'll allow a comment period from the public, and then they reconvene, talk about it again, and then they say, here's our final instruction or our final rule. And then that, in effect, can also become laws. So when you have laws from states, it might be a regulation or it might be a statute, but now you know where it came from. If it's a statute, it came from the legislative arm. If it's a regulation, it came from the executive arm. And judicial, what do? They interpret the law. So case law is made every day. They're not making law directly, but when they decide on a case, that's the precedent that's set for the rest of the time. So that happens all the time with a lot of issues. And so it's important to pay attention to how cases were decided when you have the opportunity to hear that, whether it's a news highlight, because that really sets the tone until it can start at a state level and then ultimately get up to the Supreme Court. And then that is why it's the law. SCOTUS is the law of the land. So whatever law they lay down, no matter what has come up to them and they've decided to accept and actually look at, then that's going to be the law that everyone else takes precedent with. So federally, they have a Circuit Court of Appeals. There's 12 of them. Nebraska is actually in the 8th Circuit. And then your state might be in a different one. You just have to check. And then there's district courts, and Nebraska is one of those. So I forgot to tell you this. So the Federal Register is the executive documentation book that they keep track of laws or rules. And then obviously over here on the judicial side, it's the U.S. Reports or the Federal Recorder. Those are just the names for the books or pieces of documentation that they record all the decisions. Nebraska, just going to say real quickly, it's a unicameral, totally different than this, and it's I believe it's the only state in the country that does this. And so they also have divisions of legislative, executive, and judicial, but it plays out a little differently. Anybody, if you're part of the NPA, does anybody belong to the Nebraska Pharmacists Association in here? Okay, a couple people. They gave out their last, let's see, it was September, October 2023, a really good rundown of how the unicameral works in Nebraska. So if you're interested in finding that out, it's very similar, but it's just one body and 49 senators, and as opposed to two different bodies. Okay, who makes the rules for technicians? Well, it's really kind of about the Pharmacy Practice Act, and each state makes their own, but where do they get that? Do they just come up with that out of thin air? No. NABP, National Association of Boards of Pharmacy, they have what's called a model Pharmacy Practice Act. It's like the base ingredient for the recipe that you're making. You find a recipe and you say, well, I like that, but we want to tweak it a little bit because I like this ingredient more, that ingredient more. I really want to throw that ingredient in there. They give you the base. They give you the base to work with if you want it as a state. So a state board of pharmacy looks at, they'll bring up the NABP Model Pharmacy Practice Act, and that's what they kind of develop in their own way. And that's why all the statutes and regulations, that's why all your rules are different, because that state board of pharmacy has concocted what they like based on their preferences. And so when you want to know what you can do, you're looking primarily for the Pharmacy Practice Act, but there are other ways that they can institute rules for pharmacists, interns, technicians in their practice model, okay? So the functions that are specific to pharmacists versus technicians. So anybody in here can take a transfer as a technician legally from any of the states you're at? Okay. What about taking a new RX? Any of the technicians in here, can you take a new RX? I know not all states are.
That's a Carolina thing. One of the Carolinas do that.
Okay.
I'm aware of it though.
All right, so good case in point. That's what I was kind of going for. So you can see that that might be different state to state, and it depends on the state's Pharmacy Practice Act. What constitutes the practice of pharmacy? Well, they're going to have a definition. Anytime you look up in statute, right at the very beginning, they're going to have a list of definitions. They're going to have a definition for a technician. They're going to have a definition for a pharmacist. They're going to have a definition for practice of pharmacy. So in Iowa, for example, if I can read it well, it's a dynamic patient-oriented health service profession that applies a scientific body of knowledge to improve and promote patient health by means of appropriate drug use and related drug therapy. All right, kind of one sentence talks about it all. That's their definition. I'm not going to read it all, but that's Nebraska's. It's a very, very long definition of pharmacy practice, okay? So it depends on your state what they're going to say about the definition of the practice of pharmacy. Where can it be practiced? Anybody from a state that has kiosks?
Yes, we do have.
Okay, Nebraska does not have kiosks. In fact, they've said some crass, sarcastic things about them. So, I mean, I don't see that coming very anytime soon, but it depends state to state. That could constitute the practice of pharmacy. If you have a remote dispensing pharmacy, that's another location, aside from just the obvious community pharmacy, hospital pharmacy, long-term care, but there are different places that a state may allow the practice of pharmacy to be engaged in. And obviously, when we talk about technicians and what you can do, it affects your role, it affects quality of care, it affects what you can do for a patient if you're in a busy store. It depends on whether you've had training to do that. I mean, how many times have you felt like, oh, we can do this now, and I am totally not prepared to do this? Has anybody ever felt like that? I mean, I've felt like that even as a pharmacist when something new rolls out and I'm like, nobody told me what we're doing. So, so I mean, all those things play into what you do. And how many times, who has never asked a pharmacist a question? Is there anybody in this room that has never asked a pharmacist a question? Okay. So yes, the point is just that we have to work together, and there's going to be times you don't know something, and it's good to ask. There's a big shift going on. I don't know if you've felt it. I don't know for how long you've been in the profession. I believe in my practice career, dispensing is going to shift to technicians. I believe we're going to see that. I believe that we are well on the road to do that. How this happens is the precarious part of this. And it's precarious both for pharmacists and for technicians, frankly, because if dispensing goes away, nobody's responsible for you except you. And so you are going to have to be confident and know what you're saying. And that presents a problem if you feel like you haven't been trained to answer some of these questions. So I would advise you not to make something up. If you don't know, it is far less of a problem to just say, I don't know, but let me look it up or let me find out for you. You are not going to be held liable, and you're not going to be in a courtroom somewhere if you say that, okay? So when we talk about qualifications, licensure requirements, degree of supervision, ratio, all these things are going to come into play, and the shift is going to be from dispensing to patient care services. And honestly, payment for services is a big issue across the board. So federally, pharmacists are not included in the federal definition of a provider or practitioner, which is the problem. That is the problem that you see, but yet it's not directly, it's not stated like that because it's kind of behind the curtain somewhere.
But that's actually in the works now. I've been reading a lot of back and forth and how pharmacists are definitely considered providers at this point and wanting to get in front of the curtain.
It is. A lot of states are saying you're providers, and that's how they kind of remedy this. But if you're a PBM
Yep.
and you pay different states, you can see the legislative arm in this, or the judicial arm in this, right? Because they're going to say, well, federally it says you're not. So I don't really care what you say. You say like federally, you're not. Or they won't potentially do business in your state with services. You can see the dilemma for patient care, right? So this is a giant ball of yarn in terms of the compensation has to be there for there to be motivation for businesses to want to, and think of your pharmacies, right? It's a huge undertaking to change your business model to incorporate services. I mean, that's a huge undertaking. And if businesses don't think they're going to get paid, are they going to be motivated to do that? No, they're not. So somehow we have to try to make the best of all worlds and have patients be served with great patient services, tons of information, knowledge, and for you to practice at the highest level of your license. So just a quick word on work-related, when we talk about work-related boundaries, so judgment versus professional judgment, any ideas on the two definitions? How are those different? How are those different?
Judgment is what you personally think, but professional judgment will be based off of your knowledge and what your title would be.
Okay, that's it. Well, and I could have any title, but what you actually know, yes,
Right.
what your training has actually been, and that's 100% true. So you not as a pharmacist would, if somebody staggers up to the counter, their speech is slurred, and they don't remember why they're there until you really and they reek of alcohol, like your judgment as a reasonable person would say, this person's intoxicated, you know? Now, professional judgment, what would be somebody saying to you, okay, this is my list of meds. Is there an interaction with this med and all of these? Okay, that gets a little dicier because you have to have some training to know, how do these all work mechanistically, and is there a problem with that? So that's more the professional judgment part. Verification of work is another big difference. Obviously, state to state, this is very different, and hospital versus community is very different. You have tech. I had to practice saying that because I mess it up every single time. And also in the retail setting, you're less likely to see that, but a lot of audio, like visual, camera incorporation to check everything. So it depends on your state, but verification of work is typically required unless it's a specific circumstance that's been circumvented. All right, so federal laws and regulations that affect the practice of pharmacy. We know that there's Medicare and Medicaid laws applicable to all healthcare providers. How many of you deal regularly with Medicare and Medicaid reimbursement? Okay, a few of you. And the rest of you, you have evaded that intentionally from the whole time you started working. So the Federal Food and Drug and Cosmetic Act, that's a law directed at safe and effective use of medications. And then we also have the Federal Controlled Substances Act, and ironically, each state also has their own state Controlled Substances Act. To make it easy, a lot of states just say, we're going to mirror the federal law. So if a federal law makes changes, we're going to do that too. And that's easy. That's the easy button. If you're in a state where they have a couple different drugs, you just have to make sure you know those, because I can guarantee you on any testing situation, you're going to have to know what specific difference there is in your state for the Controlled Substance Act. So, and that obviously affects C1s, 2s, 3s, 4s, and 5s. And C1s have no medicinal purpose in the practice of pharmacy with lay people, but research it is used. So you're not going to walk into a Walgreens or a CVS and see a C1 on the counter. That they won't sell it to you. That if you try to order, they won't sell it to you. You have to have a special permit to acquire a C1. All right, and then we also have a notable law in history, which was the Federal Omnibus Budget Reconciliation Act of 1990, which we know as OBRA 90. It was the first federal law to address the standards of practice for pharmacists. And so it only pertains to Medicaid patients. But imagine this for me. When a patient walks in, you have to prove to Medicaid that you counsel this patient, but the law only applies to Medicaid patients. So how many of your patients are Medicaid, how many are private insurance, or how many of them are no insurance? So you have to make that differentiation to somehow prove to Medicaid or Medicare that you counseled them, because that's part of their federal law. Can you see the dichotomy of what a mess that this patient is, this patient isn't? So what states did, states developed standards, and what they did across the board, they made every patient the same in terms of what's required for patient care, for pharmaceutical care. So the couple things that they need to know, they need to maintain patient profiles. Pharmacies need to maintain patient profiles for all Medicaid patients. They also have to do a prospective drug utilization review, or DUR. These three things are important in terms of the quiz. So maintain patient profiles, do a DUR, and they have to make the offer to counsel. Offer is an important word here. Doesn't mean they have to counsel, means they have to make an offer to counsel. And then the question begets, how do you make that offer? Is it written? Can you stick a piece of paper in the bag and say, if you have any questions, let us know? Does it have to be verbal? So you can see that there's differences, there's allowances for that, and each state comes in and says what's a requirement for them. All right, so most states have developed their own statutes and regulations, and they usually apply to all patients coming in the pharmacy, not just Medicaid patients, for that disastrous situation I alluded to earlier. And so it's definitely a paradigm shift for the way we practice, the way we look at things, we do things, how the courts look at us when things go wrong. Because if we have to counsel or make an offer to counsel, what does that do about it? Where's the responsibility? On the spectrum of responsibility, where have we just gone? We have gone up. We have gone up. Our standard of expected care has gone up because we now have to make an offer to counsel. So if something happens, it makes a patient causes drowsiness, we give them a drug that causes drowsiness, and they go out and get in a crash, then can they come back and say, you should have told me that? You know, I didn't know that. You should have told me that. So now there's some legal backing that they can say, well, this is really this is an implied duty that you have, is to tell me these things. So it definitely significantly changed the way we do that. All right, so the law piece is out. Make sure you know that the legislative branch makes laws. They pass bills and they're called statutes. Make sure that you know that the Pharmacy Practice Act is the document that's the base document for how the rules and regulations are created. We just talked about the OBRA 90. I won't say the whole thing, OBRA 90. And then when we look at license requirements, anybody here licensed in more than one state? Raise your hand if you're licensed in more than one state. Okay, just a couple. I'm actually shocked. Anybody, raise your hand if you think there might be a day that you get licensed in or credentialed or practice as a technician in another state. Okay, about the same amount. A couple recommendations I have. I'm licensed in 9 states. I should have told you that right off the bat. I'm licensed in 9 states as a pharmacist. I've only practiced in 3, but I'll tell you the marketability, that's why I'm doing what I do today. Because I went through this process so many times, I took so many MPJEs, and it gave me a lot of credibility, especially from a program that has a distance program where we have students all across the country. So ask your employer if they offer any financial assistance. That would be a good recommendation if you are thinking about getting licensed in another state or becoming a technician, because not every state requires a credential or a licensure. Delaware, Hawaii, they don't require anything. They don't require. Yes?
I was actually going to ask, why did they, because in Georgia, we all rolled out probably about 6-7 years ago, something like that, where it all rolled out at one time, where all of a sudden everybody needed to be licensed.
Because your state board of pharmacy made it so.
Made it. Okay.
Yeah,
Is there a particular reason why some states, is there like one one?
Because they have a budget and they have 2 people that work in the office. And then if they make everybody have to credential or license, that the amount of work that they've just done explodes. And so it just depends on what their budget is, what their ability to do that is. And then.
Is it just like a stamp of approval, just to say, oh yeah, you got a license?
It's just whatever measure they want to employ, whether they want how much control they want to have over knowing who's a technician in their state.
You're right, you're right.
Yeah.
Instead of being licensed in 9 states, why don't you just get a PTCB certificate?
I'm a pharmacist.
Oh, you're
I'm a pharmacist, yeah. But I was a technician many, many years ago before they even required, I think I was the first year I worked, they didn't require anything and you were just trained by whoever hired you.
So pharmacists can only be licensed in like 1 state at a time?
Correct. You have to have a license for each state. So if
Whatever state you go to school is wherever you're licensed?
Not necessarily. When you sign up to take your licensure exams, you can sign up for any of the states. You can sit for it anywhere you want and take the MPJE, or now there's like 7 states or in couple territories. They don't require a law exam. It's a big huge discussion for another day. But for pharmacists, yeah, they're coming out with a uniform pharmacy jurisprudence exam so that all the states that choose to be part of that, you can become licensed in that state by just taking that one exam, as long as the state you want to go into is participating in that. They might make you do a CE. That's all in development right now. They might make you do a CE or a module or something to that effect, but you can become licensed. Did I see a hand over here somewhere? Okay. Yes.
Okay, because I'm coming from the nursing background, my nurse's license here is good in Iowa, Nebraska, and South Dakota.
Most professions are like
Like
this.
that, but
Pharmacy's not. Pharmacy's not, because somebody wants the money. So it's hard to let go of the money once you have it. Yes, exactly.
Okay.
I hope I got through all the rest. Just some test options. For the record, I have 4 children. The oldest one is a pharmacist, just getting ready to take his first job at Barnes Jewish Hospital in St. Louis as the supervisor of operations. He did all the degree things at one time, and he has a significant amount of practice. And then my next 2 are actually, no, skip 1, not anything to do with pharmacy. And then the last 2, they're pharmacy technicians. They actually work here at Children's Hospital. And so, but they're in this process, and so I thought this was interesting because this is not, with pharmacy school, I'm teaching to pharmacy students and interns. I don't deal a lot with technicians, but I think this is really relevant because the increase in the amount of technicians that become pharmacists, I think that gap is just shortening altogether. And so, but the 2 that are technicians actually are both signed up to take one of these exams this summer, much to their disappointment. And when you do click on this, these are just options, but click on the first part of the accept, because I unintentionally put 2 different links in there, so it's going to be the right link on that side and then the wrong link on that one. But it's not wrong, but you'll just go to the PTCB option as well. So one of the things when you're licensing, make sure your name matches. Look at your passport, look at your driver's license, save yourself a whole lot of headache. Just make sure that, pick one and go with that one. Get all your credentials to be the same, because when you go into test, as you progress through life, whether that's, further in pharmacy or other things, they'll make you, it will be a hard stop, because you walk in and they say, well, this isn't what it says on here, and your middle name is not here on this one, but it is here on this one. So just take a little bit of advice and try to streamline that now, get that done. MedHero, I saw it's guaranteed money back. Did anybody use MedHero when they studied for their PTCB? Okay, well, anyway, there's a guaranteed money back. I thought that was really interesting, so check that out. It's linked, all the links are embedded here. Another one that I use for all my exams, and they have practice exams for all these, the technician credential, et cetera, and that was pharmacyexam.com. And so I successfully passed at each one that I took, maybe not by much, but I did, and so it was all good. Pass is pass. So make sure you check out your state's requirements, because every state is different. They may or may not require you to take an exam, to be initially licensed, but you have to go to the state statutes that you're going to and check that out and see what is required. Okay, so now this is the fun part. There you got your law. You got your law part. This is a practical part. So improving your leverage. We talk about workplace culture. We talk about good communication. why should you be motivated to do that? And you're here. So for this group, you're here. I mean, you're spending your Saturday here. So it means something to you, or maybe you just needed student CE and you're going to lose your license. I don't know. But the fact is you're here. And so when you think about job advancement and increased wages, it's going to lead to that. Improved relationships in the workplace, that's a positive. To have good workplace culture, you're going to have better respect and appreciation for others, and others are going to have that for you. It's going to make you want to come to work every day. There's nothing worse than going to a job that you hate. You know, usually you don't last that long, and life is really long when you do that. When you do something you love, it's not like work. And don't get me wrong, like I live in your world. So I know that it's busy, and I know there are days, even if you love your job, there's going to be some, I'm ready to go home. And so, but someday you're going to be that person on the other side of the counter, or your family members are going to be that person on the other side of the counter, and you're going to want people that care about you and care about your family, and it's not just a front. I need to make money today, so I'll give you what you need, and I don't really care about you. All right, so here were my credentials. So I've practiced for almost 30 years as a pharmacist, mainly in community and compounding. My intern years were spent, or my technician years and intern years were spent predominantly in hospital. I've never been a pick, but I know that I could if I wanted to. I just didn't want the life. And so I worked full-time the first year as a pharmacist once I got out, and then I've been an at-will employee ever since, and I worked a lot of hours, really equivalent almost of a full-time, but it gave me the freedom to be able to be where my kids needed me at the time. And now they're all adults, and they're all grown. I have no grandchildren, so this is the time for me to push on the accelerator and finish off whatever part of my career I want to do. So here's my top 10 list of things that you can do in the workplace that, by my experience, are great. I just love it. And I also, at the end, I want to hear if there's something that you really appreciate about a pharmacist. I'd love to hear that too, because I take that into the next lecture or whatever.
Before you begin, I just wanted to say something. Because it was confusing when I was first a technician. The licensing for your state and then your national certification are two different things. You have to go through two different.
Correct.
Because I know there, when I was a new technician, they kept saying licensing, and I didn't know I needed two different things.
Right.
So that's important.
There are some states like Florida
Right.
that put it in their statute that it makes you feel like you have to, but yet you don't have to. And so that's a key component. Calling somebody, if it's confusing, call somebody at the board and say, okay, what do I have to do? I have to do this national certification or not? You can see why the cloudy is sometimes favored, because what do they want? They want you to be certified. They want you to be certified. And that's a good thing. Don't get me wrong. It's a good thing. It gives you knowledge. It gives you, but you also got to live. You need a job, and you want to start next week. And so, all right. So the number 10 is when you walk into a pharmacy, because I walk into a lot of different ones. Introduce yourself. Like, walk right up to the pharmacist and say, "Hi, I'm Leslie, and I'm your technician for the day. Just let me know what you need from me. I'll try to, when in Rome, do what Romans do. But if there's something specific you would like me to do at this store that you're not seeing, please feel free to approach me and say that." I mean, wow, that just right away, you're like, they're still standing there with their mouth open, because that just doesn't happen very often. So it creates reciprocal respect. When customers see that, it's a little awkward when you walk into a store and there's a line and you don't know anybody, right? And you walk right up and say, "Hi, I'm so-and-so." They're thinking, they don't even know who they're working with. But then when they hear you, they think, well, that's a nice thing to do. They don't know who they're working with, and they're going from store to store. So that's good. That's good etiquette. It's good respectfulness. And there's going to be a time during the day where you're going to need somebody's attention for whatever reason. And when you don't know their name, you're like, hey, wait, you a drive-through? I mean, come on. So when you know their name, that's super helpful, and it just sounds so much more professional, and it's respectful for them because they know that you cared enough to know their name. And so it does encourage comfortability and approachability, and people can ask questions. So introduce yourself. Communicate. Shift changes, lunches, breaks. I'll tell you, one of the things for me is my pet peeve is Okay, as I've come to find out, like shifting from station to station is really important. Everybody's got to stay on their, the rotation to go from, so that one person doesn't get stuck in one space, right? So I'm working and, drive-thru is usually busy and I hear the dinger go off and the dinger keeps going off and finally, I don't want to create waves because I'm just there as a visitor for a couple days at a time and I say, who's on drive-thru? And everybody just looks at each other. And they're like, and I'm like, okay, could you go get drive-thru, please? And I said, who was on drive-thru? I have to ask 8 questions to get to the fact that somebody went on break. Nobody knew they went on break, but they just walked away from the drive-thru without saying, okay, I'm going to go on break. So-and-so is going to take my place, or will you take my place? And then there needs to be a response to affirm that, hey, this is happening. But you can see how that leads to, and then what happens? Customer service. They're ticked because they've just waited 10 minutes for somebody to come to the drive-thru to help them. And so with any of you who work in a busy store, the phone's ringing is not an uncommon thing. It's just kind of it's a normal noise that you just hear. So sometimes you lose track of the dinging of the drive-thru, right? So it's hard to catch sometimes. So please just tell somebody, when you're going to lunch, just say, hey, I'm going to go to lunch. I'll be back in 30 minutes. So-and-so is going to take my spot at drive-thru. And then we're all on the same page and life is good. And then there's not as much of a chance that somebody's like, behind, and when you come back and somebody got chewed out because the customer had to wait for 10 minutes, then nobody's going to be chipping at somebody else because they didn't communicate. So it just alleviates a lot of that. And it decreases, prevents errors, decreases stress. It just creates a better work environment to communicate. All right, 8, treat patients like family. So that saying of people don't care what you know until they know that you care, that's real. I think that you've experienced it on the receiving end. When you feel like somebody really cares about you, that feels good. That feels good. And so that patient perception, that's going to encompass the entire team. So they might have had that experience with you, but that good feeling projection is going to go to everybody that you work with because unless you do something, somebody does something that's clearly on the other side of that. But that whole perception is going to envelope the whole team that you're on. So that's a good thing to do. It also embraces your mission as a healthcare professional, right? I mean, you're there to care about people. I mean, that's kind of what you're doing. You want people to have a better life. You want to impart the skills you've learned on helping them be successful in changes in their life and make their quality of life better. And then employers, they love employees who make customers feel valued. I mean, if you could see a little screen, if you had a screen where you could see your boss's reaction in whatever environment, if you have a very positive experience and you really make the customer feel good and you help them out of a sincere sense of, well, your employer is like, yeah, they're not going anywhere. Like, I'm not accepting their resignation, and if they want to work 2 days a week as opposed to 0 days a week, they're getting 2 days a week. I mean, you really elevate your leverage with your employer by just being a good human being, and caring about the customers and knowing that when the owner of the business knows that you care about their customers and their livelihood, you're indispensable. All right. Be willing to learn new things. I know it's hard. I lead the charge of, I don't want to learn one more new thing today. So I get that, and I get the feeling that goes along with that. However, that also makes you indispensable, because the more you know, the more indispensable you are to the business. And so you can put yourself in a position of being indispensable because you know so much. And that also increases your value, increases your worth in terms of monetary worth. Your worth is never determined by your performance. I just want to make sure that's extremely clear. But your worth in terms of the monetary amount that your employer is willing to leverage to you increases when you do things like this. So I don't know how is okay, except it needs to be followed by, will you show me? Okay? Nothing wrong with I don't know how to do this, but will you show me how to do that? Or maybe in a less busy moment, will you save that and so we can come back to it so you can show me how to do that, because I want to learn how to do that. Ask questions. Interns love working with technicians who ask them questions, okay? So you're going through a pharmacy program, and if you, as a technician, approach an intern as the intermediary potentially before you get to the pharmacist, they love that because they get to practice some of the things they're learning. They may not know, and that's okay, and hopefully they're going to say, I don't know. You can sense that, whether it's going to be a helpful interaction or not, and then you just move on if it's not. But hopefully that intern will help solve the problem, and you have continued to free up your pharmacist's time and potentially patient safety issues, because they're usually looking at something that's complex, or they've got 3 things going at one time because they have some interaction. And so it's helpful when you do that. Have a pocket notebook. Okay, I forgot to get this out beforehand, but this, my friend, she belongs in a museum. It's 30 years old, and it is a relic. And so I encourage you to have a little notebook, because if you get a number, a very valuable number for like Medicare, Medicaid, don't let it go. Keep that. Yep. Keep those and write them down so they have it in your phone. Now, the only thing I will say is make sure you audibly say, I know I have this number in my phone, because then somebody's going to look at you and be like, they're on their phone again. I'm so tired of that. So, but yes, keep that information so that you have it for next time. And that was the last point on there is, I won't lie to you, I have actually given somebody the option, even at walking into a new place, and I don't even remember whether it was an intern or a technician, but there's nothing more frustrating to me than working hard and then having somebody over to my side who's just standing on their phone. Like, for one, it's not fair, it's not right, and it's not respectful, and secondly, they're getting paid. I don't mind like an occasional, like as a pharmacist, if somebody says, hey, I have to text my daughter, I'm just going to step in the back for just a minute, or I have to take this call. Okay, fine, just communicate that, not a problem. But when you are scrolling through, Facebook or Zoom, or not Zoom, sorry, Facebook or, TikTok or whatever, and that's just, that is not good workplace culture. And so I have actually said to somebody, hey, you know what, if you want to leave early, it's okay with me. That's my way of approaching it peaceably, saying if you want to leave 30 minutes early, because they were supposed to get off 30 minutes later. So I said, if you'd like to leave early, I totally understand. That's fine with me. I was already working hard, and I was already doing all the work, and in that moment anyway. And I'm just like, it's not going to change anything. And that person ended up getting back to work for about 5 minutes, and then said, I think I'm going to take you up on leaving early. I said, okay. That's fine. No conflict, no issue. She walks, and we're happy. So, it's frustrating when you're working with people who don't want to pull their share of just responsibility. Number 6, sorry, am I done in like 2 minutes or?
We took some of your time.
Okay.
So 5 after, but I'm going to ask you guys if you can hold questions and let her finish.
Okay.
Thank you.
So, and then, but I'll stick around later, so like you can ask if you want to. So be proactive instead of reactive. What does that mean? Anybody want to say? What does that mean?
Before instead of during.
Yeah. So look ahead to prevent a problem as opposed to responding after the problem already occurs, right? So know your gifts, know what you're good at. Be willing to look at yourself and say, I know that I'm really good at this, but I'm not so good at this. And I need to get better at that, so I want to work on getting better at this, but I know this is my gift. And what does read the room? Does anybody know what read the room means? What does read the room mean? That means know your audience. If I were presenting to a group of lawyers today, I would not be quite so comical, because they're pretty serious and they're pretty dry. And so I like to have fun, and I like to engage people. And so I know your audience, know who you're talking to, know if that person just came in today and they just got diagnosed with a life-changing disease. Like, that's going to change the way you talk to them when they come in. So those kind of issues is read the room. Reliability, show up on time. Show up early. Honestly, if your pharmacy opens at 9, you have no idea if it's a busy store. As a pharmacist, I get there 15, 20 minutes early because I want to have time to get the drawers in, get everything set up. If my support staff doesn't come in until 30 seconds before we open, I am having an anxiety attack back there going, I have a line of people already in the drive-thru, I have no idea. Because you get paid as soon as you clock in, right? So you punch in, you're getting paid. So best option is just be a little early. Be a little early and make sure you're reliable. Openly communicate. Don't wait to be asked. If you're standing there watching someone else work where you know you could help in a certain circumstance, just do it. Just help, you know, just if you see that something could get done, just do it. Don't wait to be invited, you know. So what is the phrase, give a man a fish if you feed him for a day, and give a man a fish and you feed him for a day, teach a man to fish and you feed him for a lifetime. So what does that mean? That means you might solve the problem initially, right, by just giving them what they need, but it's going to come up again and again and again. So show them how to resolve the issue themselves, so the next time and the next time and the next time, they won't need your help. All right, how many of you are RXOMs? Anybody? Okay, you were? All right. So be approachable, right? So a lot of times when you're training somebody, how many of you have ever had somebody new start and there was no one training them? They just threw them back there and, okay, it's a couple people. I always love employers when they appreciate and know that there needs to be an additional person scheduled when you're scheduling a new person, because you have to take the time and you have to explain things to them because they've never done it before, and that's totally understandable. So one time I was working and that happened. I know the new hire hadn't been there for more than a couple of days, and the person training them was like a mile away at the back counter. And so every time she had an issue, she would ask me, because I'm right there near the cash registers. From a pharmacist perspective, I'm just going to tell you that's so frustrating, because it's not that I don't want to help, but I can't train somebody and do my job. That just, if I'm the only pharmacist there, and it's nothing personal, it's impossible to do a good job at my job when I have to be training someone. So that day I had a conversation with the person that was in the back, and I said, could you bring the things that you're doing back here, just bring them up to the counter, to do them right here, but that way you're right next to her, so if she has an issue, she's not going to feel bad for asking because she knows I'm busy. She's not going to feel bad, and you're going to be able to help her. And so that's what I mean about be wise, and if you're training somebody, put yourself up in a circumstance where you can still do what you're doing, but you're right there, immediately accessible, and you don't make them feel like, gosh, I'm asking another question. There's a lot of questions that somebody that's young that starts this job has very little experience, they're going to ask. The other thing is, if you have a difficult customer and you see this engagement going on, don't let them just flail. Don't let them just sink. You can kind of gently insert yourself into the conversation and be that bumper on the bowling alley so that you're directing it in the way it should go and be helpful, and everybody wins in that deal. Everybody wins. Otherwise, you have a traumatized new hire that is only going to be there for 4 days. So again, position yourself to be multi-purposeful. Be that intermediary. I want you as a pharmacist to be that intermediary. I want you to be that person that goes to the intern and then goes to the pharmacist. If you come to me, that's perfectly fine too. I'll help you. Not a problem. But when there's one of me and there's like multiple layers of others in the room, then it's helpful for me to be the last option of last resort. Think of it kind of as like a doctor's office or a PA. When you call, we all have been the patients. You're not talking to the PA. You're not talking to the doctor. You're not talking to them until that you have to be the one talking to them, or they have to be the one talking to you. Make sure that you have a willingness to operate at the highest level of your training within the law. If you're not sure, again, don't overcommit yourself. That's not worth it, but find out, educate yourself, get the training, ask for the training, put yourself in a position of being indispensable and to operate at the highest level that you're able to. Anybody have broken printers, broken equipment at time? Okay, do you know how to fix things reasonably? Okay, then you're my favorite, okay? Because as a pharmacist, I'm just gonna say anybody that steps in to just handle problems that I'm not familiar with your store, maybe you're floating, that kind of thing, just step in. They're like, I don't wanna deal with this broken printer. Not that I don't wanna, like I can, but man, I could be doing like 50 other things. And so if you could help me in this area, I would love it. And so as a technician, if you can step in and just handle some of those technical problems that are just so bothersome in terms of work productivity, you get the gold star and you get the most valuable player for the day.
Add it to your resume.
Yeah, you got it. Protect your pharmacist time, and I kind of alluded to that. For immunization, you have the immunization tool. Okay, there's so many immunizations out there, and you don't know the knowledge base of the pharmacist that you're working with. I encourage you to use the tools that you have available to you, especially when it comes to less common vaccinations. Different vaccines have different age requirements, and different states have different requirements of what you can give and what you can't give and under what circumstances. So I encourage you to use that tool, because it's not a good plan to just rely on the pharmacist's knowledge that they're going to know this minute detail about a not oftenly just administered vaccination. Phone fiasco, I'll tell you one of my best memories ever. The technician answers the phone. Whoever was on the other end must have wanted to talk to the pharmacist. I was so busy. I was on another call, and I was trying to verify somebody for something or get a consult, get a DUR overridden. Anyway, she was kind of a veteran, but she also was respectful of the patient and said, okay, well, just a minute. And I kind of gently said, what do they want? Ask them what they want. So she proceeded to say, what can I tell the pharmacist what you're calling about? And so it proceeded that it was something that they could help them with. They went on to help them. They were a champion, and I gave her, I wrote her up for one of those great things that you do in the whatever you call it in the pharmacy. But that is so important. Like, I think phones are just one thing that just could be streamlined so much better in our world, because it's a disaster because of all the phone calls. And so when you can minimize the work for the pharmacist on that, it's great. Make sure that if you have a DUR and the pharmacist is going to have to talk to somebody in the drive-thru, turn off your headset so that I can actually I don't have to come over there. So the pharmacist can just handle it from there. They hang it up. You go. That's just a real efficiency factor. That was one of those little efficiency factors as a practicing pharmacist that I notice when people do that. It's so helpful, because then they have to go back over. If I have to talk to them, then they have to go back over and turn it off. So that's always great. If you've got interns, use them. Use the interns. I actually, for this whole presentation, I actually asked my class, who are all interns, I said, what are some positive attributes that you love about the technicians that you work with? And I have a whole list I'm not going to have time to read, but I wanted to today, and because I want you to be uplifted, and that there were some really wonderful things that they said about the technicians that they work with, and some of the things we talked about today, how much they love when they do some of those things that we're talking about. Number 2, be the feedback master. Planning is everything. The how, as we talked about before, when things are rolled out, if it's rolled out poorly, disaster, right? Disaster. So planning and making sure everybody is equipped for the performance factor is huge. So as a PIC, I want to make sure that you're all prepared and feeling good about your work. Mirror, mirror on the wall. What does that mean? That means have the ability, how you look in mirrors and some of them make you look different than you really are, okay? I love the skinny ones, but, and so when you're at work, have the humility, and I say I mean myself included, all of us. I hope that you've all interpreted that I'm not talking to you, I'm talking as a part of you, that we have to have self-awareness, that we have to have the ability to look at ourselves and say, okay, I've heard this from more than one person. Is there any relevancy to this? And then have that awareness to be able to say, I could get better in this area, and here's my goal, and here's how I'm going to try to acquire that goal. Here's a new procedure that I'm going to impose on myself to try to reach that goal. So make sure that we live. Good mental health is living in reality, not the way that we want it to be or we wish it was. Because sometimes we can't change the reality. So live in that, and then do what you can to put yourself in a position to like the reality that you live in, okay? And then be an advocate for growth. And sometimes that involves change. Sometimes you might get an opportunity, you're thinking, oh, no, but it might be the opportunity that you've always been waiting for. So number 1 is the golden rule. Treat others the way you want to be treated in your workplace and in other ways. Whether you're a patient, whether you're a coworker, whether you're a boss, be truthful. be kind, just be authentic, be approachable, be who you are, and be genuine. And things like error rates and inherent worth, don't associate a person. If they make a mistake, it doesn't make them less worthy. It might mean that you employ a few different rules or a few different procedures in order to get them to be where they need to be, but it's not a reflection on their worth. And so same thing with a pharmacist, same, and so just treat people like human beings, and your workplace culture is going to be so much better. So I appreciate your time. Sorry I'm over. Okay.